It's been a week and a half since I've had the cast put on for this basal CMC joint surgery, and I have another 8 days to go. I'm getting it off a week from tomorrow. So here's what I want to tell you so far about my experience. So I said in a previous video, I chose to get the material on the inside that makes it waterproof. However, the next day I was talking to someone who, I don't know, he broke his thumb or something 2 years ago. So he had a cast and he chose a waterproof cast. And he said the problem is, once you go in the shower, once you get it wet, it takes about 2 hours for it to dry. And he said, while it's drying, it feels kind of sticky and icky, and he just didn't like it. And that was all I needed to hear. I don't need a wet cast for 2 hours in the morning or at night. That just doesn't appeal to me. So, and having it icky and sticky. So I decided to not get it wet and to use the arm cover that I mentioned in another video. I'll link it in the description box below so you can check this out. This has been wonderful. So in that other video, I show how to put it on and how to put on the extra piece on the upper part of the arm that seals it. So that has been a godsend. I wear it whether I'm showering, bath, washing my hair, washing the dog. That's what I wear. So, but here's the other issue that's been happening. So once in a while, it still hurts. So inside the joint, I still get some pain on and off. I use pain during the day as an indicator to slow down. It means I'm typing too much. It means I'm doing too much. You know, I've got my fingers free. So when the doctor said, sure, you can use your fingers to type. Well, you know, after a while, the hand gets tired. It might hurt. So I use pain to slow down. I haven't even been taking pain med at night. It's been a while since I've done that. But, you know, if it's painful at night and it's not slowing down, I will take even a couple Tylenol. But the thing that's irritating me the most is that the you know, the incision was here, so there's a wound, and the material inside the cast that makes it waterproof is kind of plasticky, and it will touch that, and the wound will hurt, and it will even have a burning sensation. I even called the assistant. So at my doctor's office, I have an assistant to my doctor who I can call. Most of the time I get her live and she'll answer my questions, but she said this is normal. So I don't like that. And if I had gone with the regular cast material on the inside, the kind that you can't get wet, it just would have been cotton gauze, just like the bandage was. So then I think it wouldn't be so irritating because the bandage didn't irritate the wound. So if I do my second hand, I will not get the waterproof cast. I'll get the regular cast because I'm not going to get it wet anyway. And I think that it will be better when it touches the wound. I don't think it will hurt or sting so much. So I've got another week to go. So it doesn't sting 100% of the time, but just on and off, I'll just feel it, and I'll find myself pressing my hand against something to get the top portion of my hand to stop touching that because I don't want it to touch. Yeah. And weather is cooler outside now, you know, like in the 50s during the day, so my hand isn't warm, so it's not puffy inside, which is good. So I've got a little more room inside. So that's the only thing that's really bothering me. I'm okay with the pain. I'm even okay with the bulky cast. I'm okay with wearing the shower, you know, the shower protector thing. I don't like when the wound touches and it stings. So I recommend that you not get the waterproof cast when you're going to be having a wound. Just get the regular dry one and wear something to keep it from getting wet, and that will keep you from having that irritation. So my next video will be all about when the cast comes off and getting the removable custom splint and how that whole thing goes. And I think I'm also having an x-ray that day, and that's the day that I'll see the doctor and he'll tell me about the x-ray. So So check out some of my other videos. You can click one of the links on the right side of your screen or mouse over the upper right corner where you see a little eye and click the eye, and you'll get some other videos related to the basal CMC surgery. Thanks for watching. Bye.